something personal? When was the last time you woke up and your knees just felt fine? Not just okay, not I can deal with it, but genuinely fine, where you swung your legs off the bed, stood up, and walked to the bathroom without bracing yourself, without that familiar stab of pain, without waiting for your body to warm up before it agreed to work. For millions of people over 60, that memory feels distant, like it belongs to someone else. Maybe you've tried things, compression sleeves, anti-inflammatory creams. Maybe you've even told yourself, this is just aging, this is just my life now. But here's what I want you to hear, and really hear it. That morning pain is not your destiny. It is a message. Your knees are not broken. They are starving for the right kind of attention. And starting today, you are going to give it to them. Today I'm going to walk you through 7 specific movements, a complete morning knee reset. Some you will do before you even leave your bed. Some you will do seated. And by the time we get to the last one, you will understand exactly why so many people over 60 feel a decade younger after just a few weeks of this routine. Stay with me until the end because exercise number 1, the one I'm saving for last, targets a hidden weakness that almost nobody addresses. Fix that one thing and everything else changes. Plus, after the exercises, I have a 90-second recovery ritual that your doctor probably never mentioned. It is simple, it costs nothing, and it works from the very first morning. Let's begin. Before we start moving, I want to spend 1 minute explaining why mornings are so brutal for your knees. Because once you understand the reason, every single exercise is going to make perfect sense. When you sleep, your body is still for 7 or 8 hours. During that time, the synovial fluid inside your knee joint, think of it like the oil inside an engine, thickens. It gets sluggish. Imagine olive oil left in a cold kitchen overnight. That is what your joint fluid looks like at 6 a.m. At the same time, the muscles around your knee have essentially gone offline. They have been doing nothing for hours, and muscles that are not active cannot protect the joint. So when you stand up first thing in the morning, your knee has thick, poorly distributed joint fluid and muscles that are half asleep. Every step puts direct pressure on the cartilage and bone without adequate cushioning. That is where the pain comes from. Now here's the good news. Synovial fluid responds to movement within minutes. The moment you start gentle, rhythmic motion, even small motion, that fluid begins to warm up, thin out, and spread across every surface of the joint like it was designed to do. That is the entire purpose of this morning routine. We are not trying to build muscle in the next 10 minutes. We are waking up a system that protects and nourishes your knee. And we are doing it in the safest possible order, starting slow, starting supported, and building from there. Every exercise has a purpose. By the end, you will feel the difference. Exercise number 7. You are still in bed. Do not move yet. This is called the ankle pump, and it might be the most underrated 30 seconds of your entire morning. Here is what you do. Lying on your back, both legs extended. Keep your knees relaxed. Now simply flex both feet. Pull your toes toward you. Hold for 2 seconds. Then point your toes away. Hold for 2 seconds. That is 1 repetition. It is exactly that simple. But here is why it matters. Your lower leg muscles, particularly the calf, act as a secondary pump for your circulatory system. When these muscles contract, they push blood back up toward the heart and help draw fresh, oxygenated blood down into your legs and knees. After a night of stillness, that circulation is sluggish. Starting with ankle pumps wakes it up before any weight goes through your joints. Think of it like turning on the water supply before you try to wash your hands. You want that flow going before the real work begins. Do this 20 times. It takes 30 seconds. Feel the warmth beginning to build in your lower legs. That is blood returning to tissues that needed it. Now we are ready for the next step. Exercise number 6. Still in bed, still on your back. This one is called the heel slide, and it is the gentlest way to begin moving the knee joint itself. Keep one leg straight. With your other leg, slowly bend the knee by dragging your heel along the mattress toward your body. Slide it as far as feels comfortable. You should feel a gentle stretch, not pain, and then slowly slide it back out until the leg is straight again. The mattress underneath you is doing something critical. It is supporting the full weight of your leg, which means there is almost zero compression load on your knee joint. You are moving the joint without loading it. This is exactly what you want in the first moments of the morning. As you slide your heel in and out, you are beginning to pump that synovial fluid. You are reminding the muscles around your knee how to activate. And you are gently stretching tissues that have been shortened and stiff overnight. Here is an important note. Do not try to force your heel all the way to your buttock. Wherever your comfortable range ends today, that is exactly where you stop. Some mornings it will be farther, some mornings less. Both are perfectly fine. Do 10 repetitions on each leg. Slow, smooth. No bouncing, no jerking, just calm, rhythmic motion. By the time you finish, you will already notice your knees feel different, looser, warmer, more cooperative. Exercise number 5, still on your back. This one wakes up the most important muscle in your entire knee system. I want to talk about your quadriceps for a moment. Most people think of the quad as a leg muscle for walking and running. But for your knee, it is something much more specific. It is a living brace. A strong, active quadriceps holds your kneecap in alignment, absorbs shock with every step, and protects the joint surface from grinding. When your quad is asleep in the morning, none of that protection is available. Here is the exercise. Keep both legs straight. Now press the back of one knee firmly down into the mattress. You are not bending anything. You are simply tightening the muscle on the front of your thigh. If you place your hand there, you will feel it harden. Hold that contraction for 5 seconds, then release completely. This is called an isometric contraction. The muscle is working, but the joint is completely still. It is the safest possible way to activate this muscle, appropriate even for people who have had knee replacements or significant arthritis. Count with me. Press down. Feel the front of the thigh engage. 1, 2, 3, 4, 5, and release. Feel the muscle soften entirely. Do 10 repetitions on each leg. And please breathe normally. Many people instinctively hold their breath during a squeeze. Keep breathing. Your brain needs oxygen just as much as your knee does. Your quad is now awake. It is ready to do its job. We are halfway through. Your quad is now awake. It is ready to do its job. We are halfway through, and if you have been following along, I want to ask you something. Can you already feel a difference in your knees compared to when you first woke up? Most people notice it here. A subtle but real loosening, a warmth, a sense that the joint is more willing. That is not a coincidence. That is physiology working exactly as intended. Now we are going to move into the seated and standing exercises, and this is where things get really powerful. Stay with me because exercise number 1, coming up soon, contains the specific technique that physical therapists call a game changer for chronic knee pain in people over 60. You do not want to miss it. Exercise number 4. Sit on the edge of your bed or a sturdy chair. Feet flat on the floor. Sit up tall. Now slowly straighten your right leg out in front of you. Extend it fully, as straight as you can comfortably get it. Point your toes gently toward the ceiling. You should feel your quadriceps working. Here is the key detail that separates this exercise from the basic version. At the very top of the extension, when your leg is as straight as it gets, I want you to give your quad one extra, deliberate squeeze. Pull upward on that kneecap as hard as you comfortably can. Hold for 2 seconds. Then slowly lower your foot back to the floor. That final squeeze is called a terminal knee extension, and it targets the innermost, lowest fibers of the quadriceps, the part that physical therapists call the VMO, or vastus medialis. This is the teardrop-shaped muscle just above and to the inside of your kneecap. I will tell you more about the VMO in just a moment, because it gets its own exercise at number 1. For now, know that every time you do that final squeeze at the top, you are building exactly the right kind of strength for pain-free knees. Do 10 repetitions on each side. Lower slowly. Do not let gravity do the work. Resist it. The controlled lowering is where half the benefit lives. Exercise number 3. We are standing now. Hold the back of a chair or touch a wall lightly for balance. Stand with your feet about hip-width apart. Now simply rise up onto your toes. Lift your heels as high as you comfortably can. Hold for 2 seconds at the top, then slowly lower back down. This might seem like a calf exercise, and it is, but it is also one of the most effective knee exercises you can do, for a reason most people never hear. The calf muscle, specifically the gastrocnemius, crosses the back of the knee joint. When it is strong and flexible, it helps stabilize the knee from behind. When it is weak and tight, which is extremely common after age 60, it pulls on the back of the knee with every step, contributing to that deep, nagging ache that gets worse by afternoon. Additionally, rising onto your toes trains your ankle stability, which directly affects how forces travel up through your knee. A weak ankle means your knee compensates. A strong ankle means your knee is protected. Rise slowly. Lower even more slowly. The eccentric phase, the lowering, is where the real tissue remodeling happens. 10 repetitions. Take your time. If full calf raises are too uncomfortable, even a partial rise of 2 or 3 inches is beneficial. Exercise number 2. Still standing near your wall or chair. Place your feet together. Bend your knees just slightly, 2 or 3 inches, and place both hands gently on top of your kneecaps. Now make slow, smooth circles with your knees, to the right, forward, to the left, back. Like you are gently stirring a pot with your knees. Keep the circles small. This is not a squat. It is a lubrication exercise. Here is what is happening as you circle. Your cartilage is a spongy, avascular tissue, meaning it has no blood supply of its own. It gets everything it needs, nutrients, hydration, waste removal, exclusively through the movement of synovial fluid. When you move your joint in circles like this, you are compressing and releasing cartilage from every direction, forcing fresh fluid into every corner of the joint that straight-line movements miss. You cannot replicate this with a straight leg extension or a squat. The rotational element is unique. Do 10 circles to the right, then 10 to the left. Pay attention to any spot in the rotation that feels sticky or clicks. Do not avoid it. Slow down there. Gently linger. That is the part that is asking for the most attention. Over days and weeks, you will notice those clicks fading. One caution. If you have been specifically told by a doctor to avoid rotational knee movements due to a meniscal tear, skip this exercise and add extra repetitions to exercise 4 instead. And now, exercise number 1, the one I promised you at the beginning. This exercise is called the VMO wall sit, and it targets the single most neglected muscle in knee health, the vast US medialis oblique. Let me explain why this muscle is so important and why almost nobody is working it. Your kneecap does not sit still. Every time you walk, squat, or climb stairs, it tracks along a groove in the bone beneath it. When everything is balanced, it tracks cleanly down the center. But when the VMO is weak, and after age 60, it is almost always the weakest part of the quad, the kneecap is pulled sideways, to the outside, by the larger quad muscles. It grinds, it pinches. It creates that sharp, nagging pain on the outer or front surface of the knee. Strengthening the VMO pulls the kneecap back into alignment. The grinding stops. The pain decreases. It is mechanical. It is reliable. And it works. Here is how you do it. Stand with your back flat against a wall, feet about 12 inches from the wall, shoulder width apart. Now slide your back slowly down the wall, but stop when your knees are bent to only about 30 degrees. That is a very shallow bend. Your thighs will be pointing slightly forward, nowhere near horizontal. Why so shallow? Because the VMO is most active in the first 30 degrees of knee flexion. If you go deeper, the larger quad muscles take over, and the VMO rides along passively. We want the VMO fully loaded. That means keeping it shallow. Now hold this position. Press your back into the wall. And here is the key. Squeeze the inner part of your thigh, the teardrop muscle just above and inside your kneecap. Really focus your attention there. If it trembles slightly, that is good. It means it is working. It has probably been underworked for years, and it is not used to being asked. Hold for 10 seconds. Count slowly. Then slide back up to standing and shake out your legs. Do 5 holds of 10 seconds each. Rest 20 seconds between each hold. If the wall is not available, use a chair back for support and hinge forward slightly. The effect on the VMO is nearly identical. After your third repetition, you may feel a very specific fatigue on the inner side of your knee. That exact sensation is what progress feels like. You have completed the full routine. 7 exercises, roughly 12 to 15 minutes, all done from your bedroom. But before you leave that room, I want you to do one final thing. It takes 90 seconds and it multiplies everything you just accomplished. Here is something most people do not know about cartilage. It has no blood supply. None. Your muscles have arteries delivering oxygen and nutrients directly to the tissue. Your cartilage has zero. Everything it receives, every nutrient, every molecule of repair signal, every drop of hydration, arrives exclusively through the synovial fluid that surrounds it. And synovial fluid is mostly water. After 7 or 8 hours of sleep, your body is mildly dehydrated. Your synovial fluid is thicker and less abundant than it should be. The exercises you just did got it moving, but they cannot replace what was lost overnight. So here is your protocol. Right now, drink 1 full glass of room temperature water, ATER, not ice cold. Room temperature water is absorbed significantly faster by your stomach lining. You want that hydration entering your system immediately. While you drink, do 10 slow, full ankle circles with each foot. This keeps the lower leg circulation active while the water absorbs. Together, water and ankle circles, you are doing something elegant. You are replenishing the raw material of your joint protection from the inside out. That is it. 1 glass of water, 20 ankle circles, 90 seconds. Your cartilage will thank you in ways you may not feel immediately, but will notice over weeks. Here is the complete sequence you can follow every morning. Start lying down. Ankle pumps 20 times, heel slides 10 each side, quad sets 10 each side. Move to seated. Terminal knee extensions 10 each side. Then standing. Calf raises 10 times, knee circles 10 each direction, VMO wall sit 5 holds of 10 seconds. Finish with your hydration ritual. The entire routine takes 12 to 15 minutes. You can do it in your pajamas. You need no equipment. You do not need to get on the floor. I see people in their 60s, 70s, and 80s do this for 2 weeks and come back with the same report. The first step out of bed stopped being the worst one. The stairs got easier. They stopped bracing themselves before they stood up. Your knees are not failing you. They have simply been waiting for the right conversation. Here is my challenge to you. Do this routine for 10 mornings in a row, not 5, 10. Mark them on a calendar. And on day 10, come back here and tell me what changed. I read every comment. Your progress is not just your story. It becomes the reason someone else decides to try. If this was helpful, please take a moment to share it with someone you know who wakes up every morning and negotiates with their own body before the day even begins. They deserve to know there is another way. Take care of your knees, be patient with yourself, and I will see you in the next one.